Well, welcome everyone to the Hemophilia Council of California's first webinar of 2024. Happy to have you join us this evening. My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California, and we want to welcome you to the State of the State, or what we in the past often called the State of Healthcare in California. So tonight we're going to give a little bit of an overview of what to expect from health policy agenda this year. Before we roll into all of that, I want to briefly thank our sponsors. We have Takeda, Sanofi, BioMarin, Novo Nordisk, the Hemophilia Alliance, AbbVie, and Genentech, who help support our advocacy and policy webinar series. So with that, I want to just take a brief moment to introduce those of you who may be new to the Hemophilia Council. We are a nonprofit organization, and really our focus is to coordinate access to care and education and advocacy efforts on behalf of people living with bleeding disorders. And we really do that in collaboration and in cooperation with other rare disease patient advocacy organizations, as well as a lot of the work that we do to benefit the bleeding disorders community is really part of efforts to make sure that all rare disease patients have access to the best available treatments. And we do that in order to promote a better quality of life for all of those patients. And in line with that, our mission is to improve access to care and treatment options in order to advance the quality of life for people with bleeding disorders through advocacy, education, and outreach. So with that, we do have limited time, so I want to jump into it. I'm going to introduce Cher Gonzalez, who is a principal with the Resolute Company and has now been the legislative advocate for the Hemophilia Council for a full year now. So we have just had a great time this past year working with Cher to advance the issues that we're going to be talking about and others. And so I'm going to toss it over to her and let her give us a little update on the state budget and some of the other issues that we're going to be working on this year. So Cher?
Hi, everyone. Good to talk to you. What's on everyone's mind currently in the state capitol is, of course, our budget situation, which is not good. And how bad it is depending on who you're asking. So, for example, the legislature has its own independent, nonpartisan fiscal analyst called the Legislative Analyst Office, LAO. And that's who the legislature relies on for fiscal analysis. According to the LAO, we have a $58 billion deficit. It's a lot of money. According, however, to the governor's office, the governor relies on his own Department of Finance, DOF, to provide fiscal analysis. And according to the governor's office and DOF, we have a $37 billion deficit. It's a big difference there. And that sometimes happen. And, you know, we do have a governor who has presidential aspirations. So it's not necessarily surprising that he has a more optimistic outlook on what the state finances are right now. The big difference, why is there such a difference on what the LAO says for the legislature and what DOF says? And it really comes down to what the tax revenue is going to be. The governor is assuming a much more optimistic tax revenue coming in than the LAO. The LAO is saying that the governor is a way too optimistic. They say it's plausible, but they think it's a little too optimistic. So what's the real story? We will know. We will know probably in April. The tax revenues will come in, and in May, the governor will issue a revised budget called the May revision. So it's anywhere between, you know, 37 billion and 58 billion. We'll find out more in May just to see how good those tax revenues really came in. Now, what does that mean exactly? Okay, so we don't have any money, but what does that really mean? Well, what that means is we're going to need to use some really clever accounting in order to avoid cuts to existing programs. So what are they going to do to address the budget shortfall? Well, the governor is going to use a lot of reserves because we have billions in reserves. So he's going to do a large amount of reserves taking from our rainy day fund. But he's going to do a lot of other like clever accounting practices where he's going to reduce, delay, and fund shift. So what does reduce, delay, and fund shift mean? Well, it means any bills that were passed last year, he's just going to delay funding implementation of those bills, right? Reduce. Is there money that he's already given some programs for future legislation? Well, he's going to reduce that. And fund shift. What does that mean? Well, there are some special funds where the governor can take those special funds and put it into the general fund. That's called a fund shift. So for example, Medi-Cal has a drug rebate fund where when manufacturers give rebates back to the state for drug utilization in the Medi-Cal program, that went into the Medi-Cal drug rebate fund. The governor's like, nope, thank you. I'm going to put that over into the general fund. So that is sort of the answer right now. The good news is what that means is no cuts to existing programs. And even in some legislation, he's still going to implement that legislation. What does that look like? Well, an example would be the full scope expansion of Medi-Cal. They're going to, last year it passed, and this budget includes $1.4 billion to implement in 2024 and 2025 the expansion of full scope Medi-Cal coverage to all adults, regardless of their immigration status. So a lot of people wondered, is he going to delay implementation of that because he's delaying implementation of a lot of programs that passed last year? He has made his commitment very clear that he's going to still fully fund the $1.4 billion for the full scope expansion on Medi-Cal. So that's kind of some of the things to look for is what is he going to cut? What is he not going to cut? The good news is GHPP and CCS, those have not been slated for any cuts. In fact, nothing really in the Medi-Cal program as an existing program is slated for cuts. So that's all really good news. They're using a lot of really creative accounting practices in order to accomplish that. The real problem, however, is in the future years. The LAO estimates that we're going to have a $30 billion structural shortfall each year from now until 2028. So we got to weather this storm. That's a good, 3-4 budget years that they're estimating there will be a $30 billion shortfall every single year. And eventually those rainy day funds are going to run out. And so the real problem is what is it going to look like in 2025, 2026, 2027? We'll get through this year, but my real concern is in 2025, 2026, that this economy doesn't turn around and people need to start making a lot more money because our whole state budget really depends a lot on corporate tax receipts and personal income receipts. And I'll stop right there and see if there are any questions.
So does anybody have any questions specifically on the budget? If you follow the news, maybe you've heard some things. And so just, if you have any questions on kind of what these potential deficits mean, I think we've tried to hit on the highlights that apply most to the healthcare space. But we'll pause for a minute and remind everyone, feel free to put your questions in the chat if you have any questions on that. So I'm not hearing any at the moment. We have the proposals up here, Cher, on the screen, and I think you've touched on most of this, but we haven't really touched on the the MCO tax and what that might mean. Do you want to comment on that?
Thank you for reminding me, Lynn. So the MCO tax is actually quite interesting because just last year in the budget, the legislature did pass a tax on managed care organizations. And the federal government, actually, even after the legislation passes, the federal government has to approve of that tax in order for it to be utilized in the Medi-Cal program. Well, in December, the federal government did approve that tax, which will be effective April 1. But the problem is we need more money. So we passed the tax and now the governor's like, okay, well, that's great, but we actually need some more money than that in order to keep the Medi-Cal program stable, because what the MCO tax does is it fully goes into the Medi-Cal program. And that's how they have the Medi-Cal program stability so well, is because it's not just off of the general fund, it's really funded very heavily by the managed care organizations through a tax that they pay to the state. So now the because of the projected budget shortfall, the administration is seeking early action by the legislature to do an amendment to that tax to achieve even more money. So they want to achieve $20.9 billion in total funding to the state. It's a lot of money. That's an increase of $1.5 billion compared to the previously approved tax. So they got the tax, very excited. It passed the legislature, it's approved, but now they're going to have to go back to the legislature, and that requires a 2/3 vote to say, please, can you make the tax bigger on these managed care organizations? Because we actually need more money. $1.5 billion more. Now, you may remember that number that I gave you about the full scope expansion for all people, regardless of their immigration status, as long as they meet the income qualifications. That was $1.4 billion. Notice how the additional tax that they need on the managed care tax just happens to be $1.5 billion. And so now we're seeing where the governor is getting that money. The governor was very clear because he was asked about it at a press junket. Hey, are you going to pull back off of that expansion to the undocumented for their health care through Medi-Cal? He said, no, I'm really committed to that. We're going to make that happen. Well, now we're seeing actually how he's making that happen. They're going to go back to the legislature and request an increase to the managed care organization tax. Now, the good news, what is really, really good news? The good news is he's also going to be using that money, not just for the full scope expansion, although those numbers are very similar. They're going to be using a great deal of that money because it's a $20.9 billion total, right? They're going to be using a great deal of that $20.9 billion total to do provider rate reimbursement increases. They want to increase a number of areas that includes not just primary care, but specialty care as well. And they want to increase those reimbursement rates to be 85% of the Medicare rate. We'll know more February 1st because the proposal hasn't really been released, but we do know that a large portion of that $20.9 billion tax revenue from the managed care organization tax is going to go to Medi-Cal provider rate reimbursement increases. And what does that really mean? Well, that means that now it will be more profitable to take on a Medi-Cal patient. So hopefully that opens up access for many Medi-Cal patients, because just because you have Medi-Cal doesn't mean you have a provider in your area who will see you. Right? So this is going to hopefully increase access for many people in the Medi-Cal program by increasing the amount of providers who are willing to take on Medi-Cal patients.
Thanks for that summary, Cher. We had a couple of good questions in the chat. I'm not sure if we know what the answers to these are, but one of them is, what is the tax rate? And then the other question was, are all MCOs subject to the tax even if they are a nonprofit? Because, some of those health plans are not for profit, correct?
Yeah, so I believe that the tax does apply to any managed care organization that is participating in the Medi-Cal program. So I can, double back on that, but I believe it's a tax on the managed care organizations participating in the Medi-Cal program. That would be nonprofits too, right?
Right.
And I don't know what the tax rate is. Actually, that's a very interesting question because it's the first time anyone in all the years I've been talking about the MCO tax, no one's ever asked me what is the tax rate that they do. I think they pay a tax based on the amount of Medi-Cal enrollees they have. But let me figure that out while we talk, and hopefully I can find that answer because now I'm intrigued.
It's kind of interesting because in a sense, I mean, we call it an MCO tax, and I'm not saying it isn't, but it's specifically levied on the entities that then are basically providing Medi-Cal services through managed care, right? So it's almost like a contractual thing where they're, by providing this service, they then are subject to this tax or fee, however you want to describe it. So,
Yeah.
okay. Well, as we move on, we may have more information that we can add to that. So, so a couple other things that I'll comment on, and Cher can jump in if she has some additional information to provide. Just wanted to kind of as we sort of move past the budget to some of the other topics and areas of interest that are going to be things that we're going to be watching closely this year. So for one, we know that Medi-Cal is continuing to expand managed care more and more. So more and more of our patients who are in Medi-Cal are in Medi-Cal managed care plans. Which isn't necessarily a bad thing. Managed care can really be an efficient way of providing care for patients. But in the realm of, bleeding disorders and other rare diseases, it is something that we have to watch carefully because we need to ensure that the special care centers, hemophilia treatment centers, and those providers with expertise in treating bleeding disorders, for example, or other rare disease, that patients still are able to access those providers, even though they may not be in their managed care network. And so that can be a challenge at times. There are workarounds to that where you can get exemptions to see a specialty care provider when you have a managed care plan, but it does sometimes mean jumping through some additional hoops. And so it's something that, patients definitely should be aware of. In some counties, you really only have a single plan option. It's really many of the counties are single plan, and so you don't have any options. There are some counties in which they may provide you some options. There may be more than one. And that might be something that is definitely something that as a patient you should consider if you have a choice between Medi-Cal managed care plans. If your hemophilia treatment center is in one of those networks and not the other, well, then you definitely want to get into the network that has your treatment center and your providers. So just something to be mindful of. Also, we are, very many of our patients are enrolled in CCS, California Children's Services. And that is a program that we watch very closely to ensure that the funding is in place and that patients are accessing the therapies and the services that they should have access to through CCS. And so one other thing that's interesting to note is that the California Children's Hospital Association has introduced a ballot initiative. They have proposed a ballot initiative that would implement some changes to CCS to provide, additional clarification regarding what conditions are being covered, and also provide some provider reimbursement increases. So an increase to what we pay the doctors and the various different therapists and treaters that might be providing services to CCS patients, as well as for some additional support for families that may not have previously qualified for CCS support based on their income levels. So there is more to come on that. We don't talk all the time about, we don't talk all the time about ballot initiatives at HCC because we haven't necessarily had a lot of ballot initiatives that have directly impacted specifically the bleeding disorder community. But just to remind people, in California, we do have an initiative process where essentially kind of legislation basically can be put on the ballot, and then the voters decide instead of the legislature as to whether or not that should be approved or not. It requires that the people proposing the initiative go out and get a certain number of signatures from all over the state in order to qualify for the ballot. And that is the stage that this is at right now. So it has been proposed. It has a what we say, it has title and summary available for what they're trying to do, but they have to go and get that get all enough signatures to qualify it for the ballot. And then if it qualifies, I presume it is something that we will be talking about a lot more. And then we're always keeping an eye on Medi-Cal RX. And then I do know, we now have a couple of approved gene therapies in the United States. And I know that there is interest in, what is access to those therapies going to look like. We have had, a handful of patients. Last I heard it was maybe 4, I think, across the country that had been dosed with Hemgenix, the hemophilia B gene therapy product, and those were all commercial patients. So people who had private, probably employer based insurance. And just at the very end of last year, the first patient was commercially dosed. I see Dr. Nugent here with Roctavian, which is the hemophilia A product, and that was actually done here in California, in Southern California at CIBD. So, but I am not aware of patients who are on Medicaid programs, so Medi-Cal here in California, and they're, the commensurate programs across the country. I'm not aware of any Medicaid patients who have been dosed commercially, meaning not in a clinical trial with either of the gene therapy products. And so it continues to be a priority for HCC to work with the department and work out some kinks. They have approved policies for how they're going to cover these, but there's still kind of details that have to be worked out so that the centers all are able to feel comfortable that they're going to be able to be kept whole in that process of administering gene therapy. So that's something to continue to watch if that's of interest to you. And I do see the question in the chat about Medi-Cal, and we are going to cover that in just a couple slides too. Some of the renewals and changes we'll touch on it momentarily. I also want to mention again the legislation, the All Copays Counts legislation in California. So we don't have a new bill number yet. We're hoping to have that probably in the next week or so. But we are reintroducing legislation. Assemblymember Akilah Weber, who is a physician from the San Diego area, is the author of the bill. And we are reintroducing legislation in California to protect patient assistance programs and the funds that are there to help patients to be able to afford their copays. And so watch for more information coming in the next few weeks on that. We are going to really want to push hard and hopefully get that at least through the first policy committee this year, because last year we were blocked by the chair of the Assembly Health Committee who refused to hear the bill. We have a new chair of the Assembly Health Committee this year. We're going to make some changes to the legislation, and we're very hopeful to be able to get a full hearing for that bill in the coming year. So a couple things that we want to remind everyone to keep in mind with these proposals. It's really early in the process right now here in January, right? So, lots can change through the budget process throughout the year. Like, it's such good news that there are no cuts to Medi-Cal and CCS and GHPP in what the governor is currently proposing. But we're going to continue to watch that, right? It doesn't mean necessarily, and I don't want anyone to panic and I don't want anyone to be overly concerned, but if the revenue continues to look poorly, that doesn't necessarily mean that they may not have to make cuts further down the line in the process, right? So we will remain alert to that in order to protect those programs. And that's why it's really critical that you get involved, and we would love to see you come out for Future Leaders for our high school students and Legislative Day for all of our community members coming up here in March. And so just a couple quick reminders, GHPP, we've talked about a little bit. If you're not familiar with that, that is for those 21 and older. CCS is for those up to age 21. And we have a lot of other resources on those programs. If those are things that you might need assistance with, but are not familiar with. And then here's the critical update for Medi-Cal. So this was what Dr. Nugent was mentioning in the chat. Medi-Cal what they call Medi-Cal redeterminations are going on. So in the past, you've always had to renew your Medi-Cal every year. During COVID, they stopped doing that renewal process. You didn't have to fill out any paperwork. They just continuously kept everyone going because they didn't, during the healthcare emergency, it was like declared specifically a health emergency. And because of that declaration, they didn't want anyone to lose their healthcare coverage. And so they just kept everyone rolling. Those redeterminations have started. And unfortunately, despite the fact that California, I really do think, has made a solid effort to communicate with patients about the fact that they're going to need to renew. What we're finding is a pretty high percentage of Medi-Cal patients are losing coverage, and many of them are losing it purely for administrative reasons, meaning it's not because they filled the paperwork out and sent it in and Medi-Cal said, oh, you're no longer eligible, you make too much money now, and so here, we're going to move you over to cover, here's your covered California options. It's because they're not responding. Maybe they've moved and didn't get the paperwork. Maybe they got the paperwork and they just didn't open it. Maybe they got the paperwork and they opened it, but they got overwhelmed and didn't understand what they were supposed to do, and so they didn't respond. So whatever the reasons, there are way too many patients that are losing their coverage for, again, just not responding. So we really want to encourage you, if you are on Medi-Cal, if you serve patients on Medi-Cal, please spread the word that they are going to, if they have not already gotten this paperwork, they will be getting it, and they need to fill it out and respond. If they need help completing that paperwork, your hemophilia treatment center, if you're seen at a treatment center, is a great resource. The nurses and the social workers there are very familiar with this process and will be able to assist you. You can also contact us at HCC, and we will be happy to, assist you as well. I was made aware, the state actually reached out and made a bunch of, a lot of folks aware. Sadly, scammers are out there, right? And they use opportunities like this to try to scam patients. And so I am aware that there were scams going where people were being sent information to make it seem like, if they paid this company, that they would help them with their Medi-Cal renewal. You should not have to pay any money to get this paperwork filled out. The state is not requiring anyone to pay anything in order to apply for Medi-Cal. So, never pay anyone to assist you with this paperwork. This is a process that you should be able to go through at no charge. And again, treatment centers, HCC, there's various different patient support programs that can help you complete that paperwork. And then the additional point, and Cher touched on this earlier, we do now have Medi-Cal expansion for eligible adults between the ages of 26 and 40. Now, the reason that this is the age group is because previously it had already been expanded for those that regardless of their immigration status, under age 26 and over age 40. So this 26 to 40 was the last group which only had limited scope Medi-Cal available to them if they could not confirm their immigration status. That is gone away, and now regardless of your age, if you qualify based on income, you will be able to get full scope Medi-Cal. We have been told that if you already have limited scope Medi-Cal in place, you will automatically be updated to full scope Medi-Cal if the only reason that that you had the limited was because of immigration status. But again, if you are experiencing difficulties with that, then we can assist you. I think the really exciting thing about that is I know our centers see children that previously had Medi-Cal and that were able to be treated, who have mothers in many cases, right? Boys with hemophilia who had moms that had no access to treatment, even though they were experiencing bleeding. Maybe they had aunts or uncles or other relatives that again fell into this age group where they weren't receiving that coverage. They should now be eligible to receive help. And so we hope that folks will take advantage of that if that is their situation. All right, we're running short on time here, but I want to kind of run through a couple of other updates and I'll open it up for questions for those that want to stick around. We have a new initiative this year where we are partnering with other rare disease patient groups to do more work across these issues of advancing quality of care. And so we welcome, folks from sickle cell and cystic fibrosis and other groups who are joining with us to continue these fights for access to care. And then also want to remind folks that, it remains difficult at times to access mental health, behavioral health, substance use help, just because of a lack of providers. And it's, there's such a great need and not enough providers to fill all the need. But those important services are covered through Medi-Cal and GHPP and many private insurers. And so if that is something that you or a family member need, we really encourage you to seek, seek that assistance. And I'm going to kind of jump past this just for the sake of time, because I want to focus on things that are coming up this year. We do have, again, you're on our first webinar for this year. We'll be having others coming up pretty much monthly throughout the year to help keep you informed on policy topics. And then we also have our Advocacy and Access Ambassadors program, which is kind of a more advanced advocacy and access training for those that want to do more. So we would love to have you join us for that. Washington Days, I believe the registration for that has already closed, unfortunately, but that is coming up at the beginning of March. We'll be going to DC, and there's actually a lot of exciting momentum on a number of issues related to access to care at the federal level right now that ultimately I think will benefit us here in California as well. And then I mentioned Future Leaders and Legislative Day. Registration is closing soon for both of those. And so we would really encourage you to join us for those opportunities to advocate on behalf of the community. And I'm going to go back to a couple questions here. But I just want to land on I'll land here during the questions on our screen. So you have our phone number and our email address if you need to reach out. There was a question, those patients that fall out of Medi-Cal, it's not an automatic thing in terms of they are not disconnecting people at the end of COVID without giving them an opportunity of renewing. So it's not like an automatic disqualification. It's more just that now on a rolling basis going forward, they're asking people to file the annual renewal paperwork. And if they don't respond, then they might get, then they could potentially lose coverage for that reason. And then we have a list, we can get, Andrea, if you could get the link from the list of mental health resources. I think we maybe hopefully still have that up on the website that we can throw into the chat.
Oh, Sí, estoy buscando eso ahora mismo. Y puedo poner,
Yes, I am looking for it now, and I can share that in the chat.
Perfect. Thank you. Okay, any other questions? I went a little bit over time. There was like lots of information to share with everyone this time. But any other questions about what's coming up or things that you've heard that maybe we didn't touch on that you're wondering about? Not seeing any other questions. So I'll just say thank you so much. Thank you, Cher, for those updates. And thank you everyone else for joining us tonight. We look forward to hopefully having you join us for future webinars, as well as Legislative Day and future leaders coming up for our high school students, so that we can just continue to advocate on behalf of all the bleeding disorders and rare disease patients in California and ensuring access to treatment and care going forward. So thank you for partnering with us on that, and I hope you have a great evening.